Hi, this is Dr. Demestri. So thanks for this great question. So referring to if it's just as challenging to reconstruct the breast after mastectomy using an implant versus the DIEP flap or the transfer, the living tissue transfer of belly fat to the breast. And yeah, I would say that both have their own challenges. DIEP flap surgery is certainly more technically challenging because we are harvesting the tissue, which will, serve as the implant as a living tissue transplant. So it's microsurgery, it's technical surgery, but for those who are trained in it, DIEP flap surgery becomes fairly routine. Whereas implant placement, typically you don't need any additional microsurgical training. So the surgery itself of positioning the implant is not as challenging, but I would say to get a beautiful aesthetic result, so exactly how to position it, certain little tips and tricks can be quite challenging. Hope that answers your question. As far as second surgeries go, all breast reconstruction pretty much requires at least 2 surgeries to get to the most complete aesthetic result. So in a DIEP flap surgery, the second surgery would usually be a little bit of liposuction contouring of the abdomen, and then a little bit of touch up in the breast. Sometimes I tighten them, lift them further, do a little bit of fat grafting, to a little bit of hollowing up here. And the second surgery is much less involved. Outpatient surgery, kind of 1 to 3 hours, depending what we're doing.